learning more details about Hugh Hefner's death and how E. coli may have played a role. Here to tell us more, Dr. Richard Chaffoo. Doctor, good morning. Always good to see you.
Good morning, Shally. Good to see you.
So it's reported that a drug-resistant strand of E. coli was actually the factor. I mean, he was, though, pretty old as well.
Yes, exactly. And as you mentioned, you know, the extremes of life, those that are very young and very old, have compromised immune systems. It's important to remember that we have E. coli naturally within our intestines, and so what probably happened in his situation was that one of the more resistant strains overgrew the normal flora that exists in our system, and of course he couldn't respond to that very well, and it became an overwhelming infection. The actual bacteria got into the bloodstream, causing septicemia.
Okay, so if that was in my system, I would have probably been able to fight that. But because of his age and because he was older, and if he had any other underlying health issues, it made it harder for him to fight that.
It made it much harder.
Okay.
Certainly, if you have cardiac and respiratory failure in addition to septicemia, you know, the body's only able to respond when it's in its best condition. But the more organs that are involved, unfortunately, the worse the prognosis.
Dr. Chaffoo, how do you think he even got that?
Well, you know, we get E. coli commonly from things like food poisoning. We know we have certain strains of E. coli that exist in our gut that are normal flora, that are not harmful, but we also have those that are pathogens or can cause infections. And so it was probably an imbalance in that. So it probably started somewhere, perhaps in his intestines. He may have had an abscess or infection localized somewhere that allowed those bacteria to then seed his bloodstream and develop septicemia and extend throughout his body.
And then what would the symptoms be? And then how is that different from, let's say, food poisoning?
So actually very early on the symptoms could be quite similar, but it's worse. You actually begin having chills, fever, rigors, and actually also a problem maintaining blood pressure. You get very hypotensive, so it's difficult to maintain a blood pressure. So the symptoms may start out very similar, but they become more severe as the infection progresses.
And then are there drugs or any type of medication that one can take?
Yes, there are very effective antibiotics for many of the strains of E. coli. The problem is that there are actually antibiotic resistant strains, you know, because we're using antibiotics too much, either, you know, misuse or overuse. We're seeing resistant strains of bacteria that are trying to survive these antibiotics, and it makes it much more difficult for physicians to treat people when they have a resistant form of E. coli or some other bacteria.
And then the piece of advice you would leave the rest of us?
Make sure you, I'm sorry.
I know what you're going to say, wash your hands, right?
Absolutely, wash your hands frequently, the CDC says, and make sure that you get your vaccinations. See your physician for regular vaccinations, because it's easy to think, oh, I'm vaccinated against that, but in fact, the vaccination schedules are changing. There are new vaccines coming out all the time, and it's really important, incumbent upon all of us to make sure not just our children, but we stay healthy and vaccinated and current and up to date.
Dr. Chaffoo, always good to see you. Thank you.